Oklahoma has long struggled with higher than average rates of deaths due to alcohol, drugs, and suicide, and those numbers continue to rise. But as Jason Doyle reports, the state and tribal nations are working together to find solutions for people impacted by substance abuse and mental health issues.
It's a community issue.
The Oklahoma State Department of Mental Health and Substance Abuse Services recently launched programs to help connect Oklahomans with services to help them in a mental health crisis.
We see higher rates of all types of negative health outcomes as it relates to people in Oklahoma, and we're really trying to change that, especially as it relates to mental health and addiction.
Oklahomans dealing with addiction or other mental health problems is related to overall health.
It shouldn't be surprising to folks to see us higher rates of death as associated with suicide and addiction, because we have other higher rates of obesity and trauma and all types of other negative health outcomes, because the mind and the body are connected, and so it's kind of like a package deal.
A new report by the Trust for America's Health called Pain in the Nation 2023, the epidemics of alcohol, drug, and suicide deaths, confirms residents in the Center State are struggling. In 2021, Oklahoma saw a 14% increase in deaths related to alcohol, drugs, and suicide.
So what we saw for the state of Oklahoma is that with the combined alcohol, drug, and suicide death rates in 2021, over 2,600 individuals died due to alcohol, drug, or suicide.
That increase tops the national average of 11%.
And when you break that out by alcohol specifically, it was a 13% increase over the previous year. By drug overdose, it was an increase by 26%. Suicide was more modest. It was a 1% increase, but it was still almost 900 people who died by suicide in the state.
Trust for America's Health President and CEO Dr. Nadine Gracia suggests programs helping curb the harm from addiction or suicide are needed in Oklahoma and the rest of the country.
There are prevention and proven prevention programs and policies that actually help to promote optimal health and well-being.
Specifically in Oklahoma, as it relates to all of the different resources, the one thing that we've rolled out in the last year that's super important and really a game changer as it relates to accessing treatment, accessing resources and support is the 3-digit number 988.
Hayes says when a person calls 988, access to resources begins there.
Oklahoma is actually leading the nation in our ability to implement and provide what services are behind 988. So it's not just the 24-hour, 7-day-a-week counselor who's answering the phone, but it's also those connection to treatment resources. And then if that call's not enough, we have another layer.
He adds most people who have called the hotline so far have just needed to talk.
Now for 92%, I think is the stat right now, of the people who call in, that's all they needed was that call, that moment of kind of being heard and helping to navigate a resource or to identify what the next steps would be.
But for those who are in extreme danger, 988 can be a lifesaver.
For about 8% of the people, there's more of an emergent need going on that needs to be solved in a more timely fashion. And so we are able to dispatch what we call mobile crisis team.
Another program addresses overdoses with the distribution of free naloxone and fentanyl test strips.
We see research time and time again that these harm reduction strategies work really well, and that if you're able to disseminate the naloxone and the fentanyl test strips, somebody is more likely, I think 90% more likely to engage with conversations about treatment and recovery because they feel valued and heard.
Dr. Gracia says harm reduction tools are a good thing because drugs are becoming more dangerous.
And we're also seeing just even a greater toxicity of the drug supply, for example, that is circulating in specific communities that's causing higher rates of drug overdoses.
She adds addiction and suicide hit communities of color harder.
We also saw this among Black individuals as well as American Indian, Alaska Native populations. And so tailoring and ensuring that populations that are being disproportionately impacted have the resources needed is critically important.
For Oklahoma's Native population, that work is underway thanks to a PSA campaign targeting Indigenous youth in Osage County.
What it is to show environmental strategies and looking at substance use issues in, well, we'll say Osage County, because that's where we're working. And it's just a way to promote the work that we're doing, promote family connectivity, school connections, just being a way to use culture as prevention.
We were able to reach out to different community members through the NAYA, the Native American Youth Influencers, to request families, kids in the area to be able to put on these PSAs that we're having. Because if we don't have community involvement, then it's hard for us to actually do something for that specific community.
It's only recently that the federal government started funding tribal efforts to prevent and treat addiction. The new messaging is made possible with the help of the Association of American Indian Physicians and the federal government's Substance Abuse and Mental Health Services Administration.
We want to really have our young people look at their culture as being their foundation, going back to our traditional ways of knowing. I think this campaign does a good job of saying yes to that, saying yes to not just our culture, but other things that are positive, like sports, whether it be arts.
It's too early to tell if these programs are having an effect on the death rate due to addiction and suicide in Oklahoma, but the groups hope this action will pay off in the near future. Jason Doyle, the Oklahoma News Report.